Go further with the American Express Business Gold Card. Earn 3 times membership rewards points on flights and prepaid hotels when you book through AmexTravel.com. Whether your destination is a business conference or a client meeting, your purchases will help you earn more points for future trips. Experience more on your travels with Amex Business Gold. Terms apply. Learn more at americanexpress.com/business-gold. Amex Business Gold Card. Built for business by American Express.
Expedia and Visit Scotland invite you to come experience the beauty that awaits in Scotland. The sweep of wild coastlines, quiet lochs, and untamed landscapes. Fresh cuisine that feels rooted in the land. Come experience the kind of stillness that stays with you long after you leave. Plan your Scottish escape today at expedia.com/Visit Scotland.
Why is expanding participation in clinical trials so important? Well, put simply, expanding participation in trials helps us to understand how well a treatment works in all the people who may need it. Your listeners may not know it, but too often the patients who are most affected by certain diseases are left completely out of the clinical trials for the drugs to treat those diseases. And that means we may not fully understand how well a treatment works for all the people who may need it. So when treatments are tested in only a narrow or homogeneous group, what can happen is researchers may miss critical information, such as the side effects or safety concerns that could affect the groups or the people or the populations that are not included in that study. So quite simply, broadening participation actually improves the science. And that's what this program is setting out to do, to expand participation in clinical research, to strengthen the evidence behind new treatments, to drive better health outcomes for everyone, and to save lives.
So when I say what is the one thing that we do better in our program than any other program in the United States, is that we're training a generation of community-oriented clinical trialists who know that they must ask and how to ask communities and how to educate communities. That really is the basic blocking and tackling of why this program is outperforming any other program in the United States at this point on getting those rural and at-risk communities on the trials, is because when people know that you care, then they will actually do things for you that will benefit their own communities and themselves.
Hey everyone, this is Jonathan Marks from Go2 Health. I hope you're having a wonderful day. You know that on this show we focus on evidence-based medicine, and the input for evidence-based medicine are clinical trials. But who participates in clinical trials is critical. We need to make sure that all populations are represented so that we can create the best outcomes and medicines and procedures possible. Participation in clinical trials is a critical issue that impacts all Americans. Too often, the patients who carry the greatest burden of disease are left out of the very trials designed to treat them. This lack of representation not only limits access to cutting-edge care, but also weakens the science that drives new treatments, which slows progress. Expanding trial participation ensures that new medicines are tested, safe, and effective for everyone who needs them. The WIN Awards program, that's WINN. This program exists to address this critical issue. Founded in 2020 with a $100 million grant by the Bristol-Myers Squibb Foundation, an independent charitable organization, and implemented by the Virginia Commonwealth University's Massey Comprehensive Cancer Center, the program's mission is to improve participation in clinical studies to drive better health outcomes in all communities to save more lives. You can learn more at winawards.org. That's WINN, winawards.org. With us to talk about this today are two guests. Catherine Grimes is the president of the Bristol-Myers Squibb Foundation, an independent charitable organization committed to improving global health. Catherine launched the BMS Foundation's partnership with the Robert A. Wynn Excellence in Clinical Trials Award Program, an effort that is helping to transform the clinical research landscape. Catherine also led the foundation's global cancer work, which has strengthened cancer care systems that deliver critical services to medically underserved communities. Also with us is Dr. Robert A. Wynn. the namesake of the Robert A. Wynn Excellence in Clinical Trials Award Program. Dr. Wynn, MD, is the director of the Virginia Commonwealth University's Massey Comprehensive Care Center. He is leading the nation in establishing a 21st century model of equity for cancer science and care in which the community is informing and partnering with Massey on its research to best address the cancer burden and disparities of those the cancer center serves. In which the community is informing and partnering with Massey on its research to best address the cancer burden and disparities of those the cancer center serves, with a local focus but a global impact. Before we get to our guests, a reminder and a request. If you are enjoying Go to Health, please give us a thumbs up or a 5-star review on Apple, Spotify, YouTube, or wherever you're listening to us. It really helps us reach more people. Thank you in advance. So welcome to the show, Dr. Robert A. Wynn and Catherine Grimes. How are you each today?
Doing great, Jonathan. How are you?
Good.
And much better now that I'm with you. So we're good.
Thank you. That's great. Thank you for that. So tell us, what are some of the challenges around the design of clinical trials with respect to who is included in those trials and who may not be? Tell us about that first, please.
Yeah, Jonathan, I'm happy to take that. Why is expanding participation in clinical trials so important? Well, put simply, expanding participation in trials helps us to understand how well a treatment works in all the people who may need it. Your listeners may not know it, but too often the patients who are most affected by certain diseases are left completely out of the clinical trials for the drugs to treat those diseases. And that means we may not fully understand how well a treatment works for all the people who may need it. So when treatments are tested in only a narrow or homogeneous group, what can happen is researchers may miss critical information, such as the side effects or safety concerns that could affect the groups or the people or the populations that are not included in that study. So quite simply, broadening participation actually improves the science. And that's what this program is setting out to do, to expand participation in clinical research, to strengthen the evidence behind new treatments, to drive better health outcomes for everyone, and to save lives.
Can you give us some background about why or how some of the patient populations are not included in clinical trials, just so we have a better understanding of that?
So I would say at risk right now are rural communities and at-risk communities that have traditionally not been involved in clinical trials. You may say, so what's the big deal about clinical trials? 36% fewer people are dying from cancer in 2025 than they were in 1991. I wish I could say that's because more people are going to the gym and eating healthier like kale and drinking carrot juice, but that would probably not be true. What is true is that prevention and better screening and those types of things have helped. But the advent of clinical trials, ensuring that all groups have access to trials when this end of the standard of care when you've reached the end of the standard of care. The truth of the matter is that if we're at 36% now, my goal is to have more accessibility to trials in rural communities and at-risk communities, because it's not about experimentation with trials. We've been using the wrong language. It's about, once you reach the end of the road with standard of care, giving you either hope for today that this new miracle drug could potentially work for you, or if it doesn't work, we can tweak it and make it work for someone else in the future. I actually think rural populations and at-risk populations deserve that same opportunity of hope. And so this program has been really unapologetic about gearing the ability to make those wonderful potential access to clinical trials accessible to at-risk communities and rural communities. Because wouldn't it be wonderful if 10 years from now we were able to say 50% fewer people die from cancer across the United States? This program gives us a chance to do that through its focus on clinical trials for all.
Great. Catherine, do you have a comment on this?
I would just say this program is about building trust between the physician research scientists and the communities they serve. And it sounds like a simple thing, but it's not something that's taught in medical school, and it's not something that's taught in other clinical trial training programs. And it's the secret sauce to our program. We're not only training these junior or early stage investigator physicians in the science and the biostats and all that of how to design and conduct a clinical trial, but equally as importantly of the importance of the community, understanding the community, engaging with the community, and This is not the role of the navigator or the outreach person on the team, which has been the case to date. We are saying that is really part and parcel to the physician's role as a leader of these trials, and the required element to break down those trust barriers and let those physicians engage with the community and engage them in this important research.
Good. Thank you. So I just want to put this in context for our audience. We've done a lot of shows on evidence-based medicine. And what I've said repeatedly, and we've had other guests on, is to talk about the gold standard of clinical trials and how important clinical research is. And what the WIN Awards program is doing is making sure that these clinical trials are expanded to all populations, whether they be rural or at-risk populations, so that we can really get accurate results for all populations. So let's talk about the WIN Awards program, and let me spell that. It's WINN. And if you want to learn more about this, you can go to winawards.org. That's WINN awards.org, winawards.org. So let's talk about the WIN Awards program, how that got started, and where you are so far.
The best part about this is that this program fills an unmet need in the United States and globally. What's that unmet need? To generate a next generation of clinicians who can not only design trials, but understood that designing is good, but designing and ensuring that you're able to break down the barriers so that people can get on the trials is even better. This program actually started because I recognized that as we were making progress in the fight against cancer, that there were some communities that were either lagging behind or not even touched. So this program, through the vision of Bristol Myers Squibb Foundation and a number of people, got off the ground to says, if we are in the business of believing that science matters and that clinical trial has been a major tool in the toolkit of allowing us to have reduction of cancer deaths, then why aren't we expanding this to more communities? The secret sauce, again, as mentioned by Catherine, is that we take the science seriously, but we also take the science of communication, the science of educating communities, the science of ensuring that we're transparent, that we're authentic, that we do more than just show up, that we are continually following up, is all part of the puzzles of how we're going to get those people who are traditionally not on the trials onto trials in America. So that's what we're feeling pretty excited about. And we now have the data to back it up.
Yeah, I'll just add to that, to just take that one step further. We've got the data to back it up. So we set out with a bold vision to truly transform the clinical research landscape. And we are actually realizing that vision. The data we're seeing on these over 300 physicians who've been trained to date to be community-oriented clinical trialists, we are seeing meaningful and statistically significant results and improvements in how well their trials are representing the populations truly affected by the disease under study. So what does that mean? It means that the trials that these physicians are recruiting for are more closely matching the epidemiology than the disease being studied by a statistically significantly improvement over industry standards. So we're thrilled. I heard Dr. Wynn has called this a game changer, and it really is. The work these physicians are leading across the country are helping to ensure that the treatments that are developed are thoroughly tested, they're safe, and we now have confidence that they're effective in all patients.
So tell us a little bit more about the progress you've seen since the program began. How old is the program? I understand you've trained 300 physicians. Give us an overview of the progress that's been happening so far.
We actually are working on our 5th year. We actually went back and looked at our first 3 groups, first 3 cohorts. Here's what they're doing. Not only are they able to put more rural patients and more patients from at-risk communities on the clinical trials, but they also are impacting the health systems in which they work. One quick example, there's one of our trainees that actually has gone back to his hometown, and he said, Dr. Wynn, without the program, I would not have been able to do the following. I grew up in a place where cancer was everywhere and everyone died and no one actually had access to clinical trials. He went from having 0 clinical trials to now 50. And he's looking next year at 100 more. And so we're talking about 100 more people in his community alone that have a chance of not only hope, but a better life. That's what this program has done in a very real way, giving people hope through the training of these young people so that they'll take what they've learned and bring it back to the communities. And that's happening in real time.
That's amazing. So, Catherine, before you mentioned about trust with community, can you talk a little bit more about that and the importance or the role of trust in doing clinical trials in particular communities?
Yeah, Jonathan, we actually looked at all the barriers when we set out to design this program. What are the barriers that are preventing these patients from participating in clinical trials? And you can imagine they are numerous, everything from cultural to socioeconomic, geographic, and this issue of trust or lack of trust really definitely is a significant one, but there's also lack of information and lack of access. And that also leads to the mistrust. And so that's what we really set out specifically and deliberately to design this program around, is training the physicians on how to engage with the community and how to earn and garner their trust. And that's what this science of community outreach is all about. It's not taught in medical school. It's not taught in any other program that's training physicians how to become clinical researchers, clinical scientists, and it is what we consider our secret sauce, that by training in this teachable skill, training physicians and training them in a new way to understand the importance of the community, to engage the community in their research from the very beginning, and to break down those trusts. And that's really exactly what the Win Award scholars are doing in communities across the country. And we think that impact is going to be felt for years to come.
So think about this, folks. If you want to do a clinical trial, you have to have participants. And to get participants, you need to recruit them. And what we're talking about today is the issues in recruitment and participation so that we can have complete clinical trials. So tell us both, what challenges still remain in expanding participation in clinical research?
Yeah. So in an era where there's Dr. TikTok, Dr. Google, and a whole lot of other white noise, there is a level of understandable mistrust and distrust within our communities. What we need to be better about is being able to not only, quote, talk about research, but actually talk about it in a way that it's accessible so that you understand that if you have a grandfather or a parent or a brother or sister who has actually, as a cancer patient, come to the end of the road of having access to the best standard therapy, that there is more therapy in the context of a trial. By the way, the other issue, which is a challenge, is that most of us have agreed that these communities must somehow be so distrustful that they don't want to be on trials. Not true. Work from Nadine Barrett, who's at Wake Forest now, shows that most of those communities aren't asked. So when I say what is the one thing that we do better in our program than any other program in the United States, is that we're training a generation of community-oriented clinical trialists who know that they must ask and how to ask communities and how to educate communities. That really is the basic blocking and tackling of why this program is outperforming any other program in the United States at this point on getting those rural and at-risk communities on the trials. Is because when people know that you care, then they will actually do things for you that will benefit their own communities and themselves. And so it's caring, but building these skill sets, teachable skill sets of how to engage communities on top of the skill set of learning how to develop trials that's giving our group an inherent advantage of being able to do some good work.
So I love this message that we're getting out, really about training clinicians to be more inclusive in clinical trials so that we can really get accurate research and results for all communities. If you want to learn more, you can go to winawards.org. It's WINN, winawards.org. So for each of you, are there any questions that I didn't ask that I should have, or is there a major message you'd like to leave with people today before we end?
There is one last major message, Jonathan, and that is that for anyone interested, any medical student or early stage investigator physician interested in our programs, we do have applications open right now for the medical student program. That is our Clinical Investigator Pathway Program Award for medical students. It's a summer immersion program and mentorship for any medical student interested in getting exposure to a career path in clinical research. And in January, we'll be opening applications for the Career Development Award. That is a 2-year award for early stage investigator physicians who are interested in becoming community-oriented clinical trialists. So great timing to go to the website.
Wonderful. Good. Doctor, I'll ask for you in a minute, but I just want to underline for people the importance We have established clinicians and established doctors. What we really need to do is recruit new doctors, new clinicians, new researchers, and these kinds of programs that help train physicians and researchers in the correct and best methods are so critical. Dr. Nguyen, would you like to leave us with an end message?
I would. I think in an era where we actually believe that so much that we're not making progress and that we're going backwards, I want to tell you that the science has moved forward, particularly in clinical trials. I wish we had a different name of clinical trials as opposed to trials. But all I can say to people is, if you can believe one thing, believe this, that when the standard fails, there is still hope. And that hope is manifested through clinical trials. And so I hope most people know that most doctors in this program are just trying to do what we can do. Let's get to 50% fewer Americans dying from cancer, make the big C a smaller c. That's all I wake up in the morning thinking about doing. And this program is really based on that bedrock of wanting to do good and knowing that we can if people are involved in trials.
God bless you both for the work you're doing. I so appreciate it, and I know our audience does too. We've been talking with Dr. Robert A. Nguyen. He's the namesake of the Robert A. Nguyen Excellence in Clinical Trials Award Program. He's the director of the Virginia Commonwealth University's Massey Comprehensive Cancer Center. He's leading the nation in establishing a 21st century model of equity for cancer science and care, in which the community is informing and partnering with Massey on its research to best address the cancer burden and disparities of those the Cancer Center serves, with a local focus but a global impact. We've also been talking with Catherine Grimes. She's the president of the Bristol Myers Squibb Foundation, BMS Foundation, which is an independent charitable organization committed to improving global health. As president, she oversees all foundation efforts to improve global health worldwide through key pillars and programs in adult cancers, pediatric cancers, blood disorders, neuropsychiatry, and clinical trials. Thanks both for being with us today. It's been so helpful and so educational for all of us.
Thank you for having us, Jonathan.
My pleasure. So this has been Jonathan Marks with Go to Health. And as we say at the end of every show, go to health. God bless. We'll see you again next time. Take care. Thank you both.
Thank you.
Oh, no, thank you. This is awesome. Appreciate you.
My pleasure. Bye-bye. Thank you for tuning in today to Go to Health. You are one of almost 10,000 people per day who enjoy the evidence-based health information offered by our guest health experts. You can watch us on our website and YouTube and listen to us on 8 podcast networks. Be sure to join Jonathan Marks in our upcoming shows each week. If you like our show, please share this episode with your friends and colleagues. You can subscribe to the show, join our email list, send us feedback, browse through the online store, and view our library of over 150 shows at gotohealthmedia.com. See you next time, and remember to elevate your life with Go to Health.
Struggling with weight loss? Prolon's 5-day fasting mimicking diet is a clinically developed nutrition program designed to promote fat loss while protecting lean body mass. Developed at USC's Longevity Institute, it assists the body in entering a fasting-like state that helps reset metabolism and target visceral fat. In just 5 days, Prolon offers a science-backed approach to weight loss without extreme restriction or guesswork. Get 15% off plus a $40 bonus gift when you subscribe at prolonlife.com/now.
Ryan Reynolds here from Mint Mobile with a message for everyone paying big wireless way too much. Please, for the love of everything good in this world, stop. With Mint, you can get premium wireless for just $15 a month. Of course, if you enjoy overpaying, no judgments, but that's weird. Okay, one judgment. Anyway, give it a try at mintmobile.com/switch.
Upfront payment of $45 for 3-month plan, equivalent to $15 per month required. Intro rate first 3 months only, then full price plan options available. Taxes and fees extra. See full terms at mintmobile.com.